He was just filled with joy. He loved his teddy. He was very, very attached to his teddy. And he used to love taking his teddy in his little pram down the road. So yeah, he was just such a joy.
Their little boy, Finney, was about to turn 3 when David and Liz paid the ultimate price of NHS failings.
He woke up with a tummy ache. He woke up a little bit before his normal time, and his tummy was clearly sore. He was saying, ouch, ouch, and he was holding his tummy. We took him to A&E, and yeah, that's when everything just kind of deteriorated from there.
The A&E department was busy, understaffed, routine checks weren't carried out, and there were communication failures.
It was just a cliched 9-hour NHS nightmare. Very busy. They were, according to their own sort of reckoning of these things, very understaffed. After a number of hours, I sort of pushed my way through to actually get him seen properly. So we spent the majority of the time sitting in the chairs in the corridor. He was examined, I think, most of the time on my knee in the corridor. It was ultimately transpired, as the coroner sort of found, there was never any proper set of observations undertaken at any stage.
He was discharged, but hours later he died. He had a twisted bowel. The coroner said different hospital care that night would have given him a chance of survival.
He wasn't given a chance. I think that's how we very strongly feel that way, that he wasn't given a fair chance. And he should have been, because he was just 2 years old. But there were a litany of failures that meant that he was robbed of that chance.
As the government announces its 10-year plan for the NHS, they know all too well it must improve.
The system is flagrantly broken. The problems with the NHS are really clear. For us, they are beyond viscerally clear. That something just catastrophically went wrong.
But they're sceptical about the promises of politicians.
It needs radical surgery. It needs something radical. It doesn't need performative little tricks around the edge with some generic waffle about artificial intelligence is going to sort anything out. And so, the government, the politicians, whatever it is, need to be, for once in their lives, kind of decisive about these things.
I think it's difficult to have been through what we have been through and have any confidence. Obviously, I hope that they will be better, and I hope that no other families have to endure what we have and what we are. But I'm not optimistic, no.
Next week, it'll be 1 year since Finney's death. Words can't convey how they're coping.
Language isn't sufficient, really, so an eternal flatness. We knew how happy we were with Finney.
He was our much-loved only child, and life without him is pretty intolerable. I think of him all the time. We miss him desperately.
Whittington Health NHS Trust says it's determined to learn from the heartbreaking events around Finley's death. Rebecca Barry, ITV News.